Hello, this is Stephanie Have doing medication video. So I've gathered a plethora of supplies here. So right now I have the MAR in front of me. I also have this computer screen, which is going to be when you're taking it out of the Pyxis or whatever you're using for medication distribution. So when I am in there, I am going to look at all the meds that I need to pull for this patient, and it should come in little single dose distribution packages. So I do want these little medication cups. I'm going to put the different medications each in a cup. So I have my med cart as well. So I see that he needs Lopressor 50 milligrams daily. I'm going to see that that's on the MAR. I'm going to log into the Pyxis, make sure that the Pyxis again shows Lopressor 50 milligrams daily. Take it out, the little drawer opens. I'm going to look at the Lopressor. I'm going to make sure that it is Lopressor 50 milligrams. I'm going to look just to make sure before I close the Pyxis drawer. And then I'm also going to again make sure that it is Frank Jones that I'm looking at on the Pyxis and the MAR. And just confirm that this is Lopressor 50 milligrams daily. I'm going to put that in a cup. So I would continue to do that for all his medications that I will be using. Since the start date is T for today, I am going to also be grabbing Milk of Magnesia. Should be a bottle of multi-doses that I will continually use for him. I'll write my name, the date and time I opened it, and take a dose from there for him. Also, I have Otic drops, optic ointment, optic drops, and an inhaler. So those, if they don't need to be refrigerated, should be able to stay in his room with him. And again, this depends patient to patient. If they do have dementia and they might get into the medications, you know, it all depends if it's in appropriate situation to do that or not. Otherwise, they can be locked up in the medication room and just saved for this patient. This is not really appropriate to be doing multi-doses for multiple people out of eardrops and eye drops, and especially an inhaler that goes in your mouth. So I'm going to pull all of these today for him. Also, he does have a Nicoderm patch, but that is a patch every day, so I would pull it just like I would the medication, checking 3 different times against the MAR and Pyxis and making sure I have that right dose for Frank, making sure it is Frank Jones that I am grabbing these medications for. So once I have everything, like I said, in these med cups, clearly labeled, I can label Lopressor on the outside. I can put his name, but it'll only be his meds on my med cart. So once I have it loaded up with all the different meds, I will take my med cart to his room. As you can see, Frank here is in the background. So when I get to his room, I am going to introduce myself, Hey, I'm Stephanie, your nurse. I'm going to be distributing your morning meds today. Can you give me your first and last name? Great. What is your date of birth? Check those against his armband. Check those against the MAR. Again, make sure I'm in the right patient room. It's the right patient. And go through these medications one by one with him. So I will talk to Frank and go through each of these medications. And when I do take a medication, I'm going to take it out of my cup. It should only be one medication in the cup. I'm going to look at it, say Lipressor 50 milligrams daily. Make sure it is what's on the MAR. It is Frank Jones. I've made sure it is Frank Jones. So, and depending if the patient is familiar with these medications, I might do more education or less education with them. But I want to do the basics with them. Frank, I have Lipressor 50 milligrams daily. Is that something you've taken before? Do you have any allergies to Lipressor? Do you have any seasonal allergies? Any latex allergies? Any medication allergies? Any food allergies? So I just want to confirm with him again what should be on the MAR for these allergies. And it should be caught by the pharmacist and the doctor, but if it's not, we're, you know, that last line where we're checking, oh, he does say, like, once he had a reaction to Lipressor. So then I would hold that and double check with pharmacist, doctor. So far he says no allergies. I'm going to ask him with each med just to double check and be sure. Okay, Frank, I have 50 milligrams of Lipressor here. It is a beta blocker. It will start to work in about 15 minutes, and it will help lower your blood pressure. This is usually for someone who has high blood pressure, also known as hypertension. Some side effects can be that you'll be dizzy and tired. Get his consent. Have him teach back to me what some side effects are and what it is for. And before he swallows pills, I want to make sure he's capable of swallowing. So I would also have a glass of water to take the pills with, but also to do a swallow screening before he does it. So I'll make sure that he can take 2 swallows of the water before we get started, to prevent aspiration or choking on a pill. So when he said, you know, he's passed the swallow screen and everything, I'm going to open it up, dump the pill in the cup, dump it in his hand. Watch him, make sure he swallowed it. Okay, Frank, next I have ASA 81, also known as aspirin, 81 milligrams. Again, I'm going to take that cup with only that pill in it, double check against what it says on the packet versus his MAR. And I will let Frank know then. Have you ever had an allergic reaction to aspirin? He says no. This is also by mouth. So aspirin will take about 5 to 30 minutes to start working. It depends what you're using it for. It can be used for pain. It can also be used for thinning the blood and heart issues. So for Frank, obviously I would know which one it is. Since he has other heart medications, I'm just going to assume for this video that it's for heart and thinning the blood. Some side effects can be gastrointestinal bleeding, more easily bruising, and taking longer to clot. When he says he's okay to take it, again, open, put it in the cup, put it in his hand, have him take it. So, next I have furosemide, 20 milligrams daily. We have it here scheduled at 8 in the morning for you. Have you ever had an allergic reaction to furosemide? Grab it out, double check it, furosemide, 20 milligrams daily. Open it up, put it in the cup, give it to him, he'll take it. Before I give it to him, sorry. This will work in about 30 to 60 minutes. This is a diuretic, so some side effects can be increased urination, increased thirst, and some cramps like you would have sometimes when you're dehydrated. Again, make sure each time I let them know this information, I'm going to have them teach back and make sure they know. Frank takes it. Next I have digoxin, 0.125 milligrams. Again, the cup, check it against that. This medication, Frank, is for atrial fibrillation, an issue with the heart. This can work in about 30 to 120 minutes. This can also be used for heart failure. So again, I would know by his chart if it's AFib or heart failure. Sometimes this can make you confused and dizzy feeling. Have him teach back. I will give it to him. He will take it. Next, Frank, I have potassium chloride, 20 micro, I can't think of the word right now. I apologize. MEQ, twice a day. This should be taken with meals. Have you eaten yet today, Frank? He will either tell me yes or no. So if he hasn't eaten yet today, I will hold that until breakfast. If he has eaten within the last 15-30 minutes, I can give it to him. He will say yes. He has eaten. So Frank, this is one that should be given with food, so make sure that this is done in the morning with breakfast and in the evening with dinner. This is for potassium depletion. Ironically, can also be used in the IV for a digoxin toxicity, which you're also on. This can cause nausea and vomiting and side effects. Have him teach back, and then I'll give it to him because he said he did eat. Next I have metformin for 8 a.m. Frank, I have metformin, 500 milligrams every day. It's scheduled for the morning with you right now. This is usually to help maintain blood sugar. It will be used for someone who is hyperglycemic or tends to have a higher blood sugar. This can help maintain and keep your blood sugar low. The side effects of this is heartburn, stomach pain, and gas. Again, dump it out, put it in the cup. I'll give it to him. Next, Frank, is Milk of Magnesia. So now I've completed all the pills. I'm moving on to his liquid. So for this, I'm going to use a liquid cup. This calls for 30 mLs of Milk of Magnesia. I'm going to fill it up to 30 mLs. I'll do that at bedside. I don't want liquid just hanging out on the med cart. So, Frank, this is for constipation. So, some side effects then is having diarrhea and cramping with the diarrhea. I will compare the bottle, make sure that it is correct 30 milligrams, and I'm doing this for all the pills as well, just again bouncing it against the MAR and making sure that they are correct, and then I can give that to him. He can rinse it down. Next, Frank, I have Otic drops. It says to your right ear twice a day. So we're going to do these in the morning and at night. I don't know what exact kind they are. So in general, the eardrops can cause headache and dizziness. I want to first give you your inhaler and nasal spray, then your eye drops and eye ointment, and then come back to the ear drops, because you will need to hold your head to the side for a little bit to let it sit in there. So for albuterol inhaler, we have 2 puffs twice a day. This one's going to be given in the morning and then around 4 in the afternoon. So with albuterol inhaler, you can have nervousness, a little bit of shaking, and a headache. It's kind of if you drank a little too much caffeine sometimes. So right now, I'm going to show you how to use an inhaler. I don't have one here with me, we'll pretend. So, have you ever used an inhaler before? I'll say yes, but I still want to teach him. So, I would teach him how to take out the inhaler cartridge, put it in. I would show him that you push down for a puff. You're going to want to take a deep breath in, blow it out, and then when you're ready to take another deep breath in, push the inhaler cartridge down to deliver medication and inhale it with your breath. I'm sorry, inhale a deep breath and then administer the drug. So, as always, I want to make sure this is albuterol at the right dose. This doesn't have any dose with it. So just make sure it's albuterol, it's inhaler. I would see if he uses a spacer or not with it. It doesn't specify on here, and there is no spacer on his MAR, but a spacer can be used as well, which gives you some more time to inhale the medicine. If you were to use a spacer, you would attach a spacer at the mouthpiece of the inhaler. You put it in your mouth, make sure your lips are pursed around it. You would dispense the medication by pushing on the cartridge, and then inhale what is in the spacer. So that gives you some more time to get all the medication that you do need. Of course, like I did, I want to confirm those orders. And anytime we are distributing medication, I just want this to be in here. You're going to do, used to be 5 rights, but now you'll do 6 rights. So you're going to make sure it's the right person. I did with Frank. Frank, you're Frank. Okay, we're looking at Frank's MAR. It is the right medication. So again, I'm looking at the packet and I'm looking at the MAR. Making sure it's the correct dose and the correct medication. Also, I want to make sure it's the right route. So when it's PO, I'm going to do it by mouth. The otic is going to be in the ear, optic in the eye, topical is going to be on your skin, and then intramuscular into your muscle. So you want to make sure it's the right route. I want to make sure it's also the right time. So I'm going through, I am distributing 0800 meds, 8 in the morning. So I'm only giving him the ones that are on the MAR for 8 a.m. And then I want to make sure that it is the right dose, along with the right medication. So Lipressor 50 milligrams, I want to make sure it is 50 milligrams. If we only have the supply of 25 milligram tablets, I'm going to give him 2. And I'm always going to double check and make sure that my calculations are correct. But always make sure it is that correct dose and medication. Always check the 5 rights. The 6th right is make sure you document correctly. So in here, the written MAR, you would initial when it's given. There are other different things you can initial in here as well, like an R for refuse. Just depends on the policies of your place. So if you do have the electronic health record, however, you want to make sure that you do document after you give the medications. Make sure he tolerated it okay. He was able to swallow all the medications. He was able to use the inhaler. Stop. I would have that all available. Like I said, I don't have an inhaler. Whoopsie. So I use my fake inhaler. Spacer, I don't even have anything that I could really use as a fake spacer, but I would have that as well if he was using one. I'm sorry, my cat is getting involved again. She likes to. So we did the inhaler with him. One thing I also want to mention, which I did not do, is shaking it. You always want to shake it before you do depress it. If this is a new inhaler, you want to give it 2 sprays before you start using it. And then once he did inhale the medications, he would hold it for 10 seconds. And then he would breathe out slowly. So those are something I didn't say when I was giving this to him. After he does that, he can rinse his mouth out. So next will be a nasal spray. Again, it doesn't really state what kind it is on the MAR here. So just in general with nasal sprays, have you used a nasal spray before? He will say yes, these are part of his home medications. This is calling, the albuterol inhaler, sorry, is 2 puffs. So I would make sure he did 2 puffs. My brain works a little wonky on timing here. It goes a little too fast before I can get all the words out. So the nasal spray is going to be 1 mist in each nostril daily. They have scheduled this for 8 a.m. Frank, I have your nasal spray here. It's 1 mist in each nostril daily. So depending, you know, if it is just saline or if it is an actual medication that he is taking, some of this might be different, but I went just in general with nasal sprays. So some side effects of nasal sprays can be headache, sore throat, and cough, as it is going in your nose and will eventually drip down the back of your throat, which is just our anatomy. So I will give him, I guess I can use this as my nasal spray too because I don't have one. Sometimes they have the tip of the nasal spray, and on either side you can push down to deliver the mist. Otherwise, sometimes it's a squeeze to deliver the mist. It really depends what kind of nasal spray you're using. So again, with this, you do want to shake it up. If it is the first time that you're using this, generally, because I use Flonase, have in the past with bad allergies, you do want to let out at least 5 sprays before you use it if this is the first time using this bottle. So I will let Frank know that when he is going to use this, he is going to plug one side, the opposite that he's delivering it in, and take a small sniff inhalation with the nose, because you want it to be delivered in the nasal passageways. You don't want to suck it all the way back down to your throat. So Frank, I'm going to have you do just 1 spray each nostril, and I can ask him, do you need help with this? I can do it for you. Again, depending what the patient's ability is. So if you're going to spray it in your right nostril, you want to hold your left nostril down, put it in your nostril, take a small sniff, because you do want it to stay in your nasal cavity. You do not want it to go all the way down the back of your throat. I also know from experience that Flonase, to me, it just tastes like allergies. So that would be something that I can let him know too, depending on what medication is in here. You want to, when you do sniff, do it for about 3 to 5 seconds. Oop, stop. Get out of here. Or, sorry. You want to sniff, like I said, small. You don't want to blow your nose for several minutes. Your nose might feel like it needs to be blown, but you need time for that medication to soak in. So after I'm done distributing all the medication, I will look in his nose for irritation. Before I have him do it, I will also look for irritation, make sure there's no open sores in there or it's irritated from the medication that he took the day before. Next, we will move on to your Nicoderm patch. So this is 0.3 milligrams in the AM. Have you had a Nicoderm patch before? Since today is the first day, I can put it, you know, on the arm or upper back. If it was one that he's been using for several days, I want to make sure I don't put it in the same exact spot. So that sits right. When you document, you should document where you put it. Just so the nurse following, if you don't always have the same patients, you know that you're not putting it on that same spot to cause skin irritation and possibly too much of the drug. Make sure there's no residue. Wash off if there is from when the person removed it at night, because I do have removed the Nicoderm patch in the PM. So for this, I did put my gloves on. You don't ever want to touch patches or topical ointments. You can accidentally absorb it into your bloodstream, and it would be on your fingers. It would be a quick absorption, unlike your arm, where there isn't as many capillaries right there and readily available. So I would take the patch. I don't have one. We can pretend. The patch, you do open it. You only want to touch the very corner of it when you do have it. You don't want to touch on all of it, because that's gonna decrease the integrity of the sticky part. So again, try to remove it, just holding bare minimum corners. Pull the plastic piece off that allows the sticky adhesive area to be available. I'm going to let Frank know that this is to help with cravings for cigarette smoking. Some things that can happen at that site is itching, redness, burning. Sometimes you can feel dizzy and nauseous when you do have the patch on. So I would ask him, have you used one in the last 24 hours? When's the last time you used one? Just so I can get an idea of where I do want to attach this. This is new because he's in the hospital. Usually he can go out and smoke. Now he can't. Non-smoking campus. So I am free to just pop it on his arm. I do want to write my name, date, and initials, so someone knows that I did put this on today in the morning. When they go to remove it at night, they're going to know that